afternoon, and thank you for joining us for another edition of Kidney Talks with the G.W. Ron and Joy Paul Kidney Center, MOTEP, the Minority Tissue and Transplant Education Program, the Pennsylvania Avenue Baptist Church, and, of course, BlackDoctor.org. I'm your host today, Suna Halley, and I'm a program manager at the GW Liver and Pancreas Institute for Quality. Today's presentation is entitled Pass the Potatoes, Not the Pneumonia, by our pharmacist, Chrissy Burrows. Chrissy is a transplant clinical pharmacist at GW Hospital, where she works to provide safe and effective medication therapy for transplant patients. She also works with patients in the pre-transplant setting to ensure they are ready for transplant from a medical perspective and medication perspective. Outside of work, she enjoys hiking and spending time with her family. Our panelists for today are none other than Dr. Keith Melancon, Chief of Transplantation at the George Washington University Hospital, and of course, Dr. Clive Callender, Professor of Surgery and founder of the Minority Tissue and Transplant Education Program, also known as MOTEP. Without further ado, we'll turn it over to you, Chrissy.
Thanks so much, Suna. It's good to be here with you all.
Yes. Thank you.
All right, let's get started. So this presentation is entitled Pass the Potatoes, Not the Pneumonia. So you may not be able to tell by the title, but we will be talking about vaccinations today and just general recommended vaccinations in the adult population. You can advance to the next slide, Suna. So throughout the presentation today, we're going to talk about what are vaccines, how do they work. There's a lot of common misconceptions around vaccines and how they work. What are the commonly recommended adult vaccines, of course, which will not be an exhaustive or an extensive list by any means. It'll be the most commonly recommended adult vaccines. And then where can I find more information? Next slide. So let's dive into what are vaccines. So there are many different types of vaccines actually, and depending on what type they are, it depends on how they work in the body. For the most part, vaccines will use your body's immune system to create antibodies towards a specific disease, and we call this building immunity. The immune system remembers the disease, and when infected in the future, it can quickly attack it with the antibodies that were made from that vaccine. Now, the different types of vaccines that we have here are inactivated. For example, our flu shot is an inactivated vaccine. The vaccination formulation, the intranasal formulation is live. So we also have live attenuated vaccines. Our mRNA vaccines, like our COVID vaccines from Pfizer and Moderna. We have recombinant or conjugate vaccines, and then toxoid. And I just wanted to bring up a point here. It's always better to prevent a disease than to treat one after it occurs. We call diseases and illnesses like pneumonia, the flu, shingles, we call them vaccine preventable illnesses because that is what they are. We have vaccines available to us to help prevent these prevent these illnesses, or at least minimize how sick we get from them. So that's key to understanding here. Next slide. So jumping right into commonly recommended adult vaccinations. So influenza was the first one I mentioned. This is an inactive vaccine, meaning that the virus that is used in the vaccine is dead. It is not live. A point about inactive vaccines is that while they are effective, they're not quite as strong as live vaccines are. And that means that we have to get doses more frequently. So that's why you have to get an influenza vaccine annually or every year. And that's because, you know, the variants change in the flu virus, but also because the flu shot is an inactive vaccine and requires us to revaccinate against it. I've divided this into sort of upper respiratory, lower respiratory illnesses, and then later will be kind of other miscellaneous vaccines. So the next is COVID, which we're all very familiar with. COVID, the 2-dose series, which is our primary series. So right now, the Moderna and the Pfizer formulations, 2 doses is equal to your primary series. And then the CDC recommends at least 1 booster at this time. Of course, other populations that are more vulnerable, like our immunocompromised population, there are different recommendations, suggestions for those groups that would, be for more boosters. But the COVID vaccine is an mRNA vaccine. It's still not made with a live virus. What the mRNA technology affords to us is to have a vaccine. It accelerates the manufacturing process of the vaccine to get it out to the public more quickly, but it still goes through the same very intense regulatory process as all other vaccines do. The pneumococcal vaccination, there's been some recent changes and developments in this area that are pretty exciting. So typically, if you're 65 years and older, or ages 19 through 64 with certain risk conditions, those being anyone with chronic kidney disease on dialysis or any chronic liver disease, it's recommended to get a dose of the pneumococcal vaccination. So the PCV15 and then our PCV20 you see on the screen, those are relatively new vaccines in the pneumonia world. It used to be that you had to get something called Prevnar 13, which is the PCV13, and then continue to get doses of Pneumovax or that PPSV23 after that. Now you can just get 1 dose of your PCV20 and be good to go. You don't have to keep going back and getting more vaccinations with Pneumovax. So that is kind of new in the world of pneumonia. Next on the screen, we have tetanus, diphtheria, pertussis, so our Tdap or TD. So this is a toxoid vaccine. So it uses the toxin that is created by these viruses to help the body create antibodies and proteins to help fight against these illnesses. It is not a live vaccine either. So 1 dose of Tdap is recommended, and then a tetanus or Tdap booster every 10 years after that. Exceptions are in pregnancy. We want to make sure we get a Tdap vaccine with each pregnancy. And then, of course, in wound management, if you have a new wound, it's recommended to get an updated tetanus shot for that. Next slide, Suna. And then I wanted to mention our kind of new kid on the block here, our RSV or the respiratory syncytial virus vaccines that we have available to us now. This is super exciting. As some of you may know, RSV was and always is a big deal, but last year during the winter and the cold and flu season, we saw a huge spike in RSV that can be particularly problematic for our more vulnerable populations, so our immunocompromised patients, our transplanted patients, our infants, and older adults. So RSV, it's a common respiratory virus that you and I have probably gotten many times. It causes mild cold-like symptoms, but as I mentioned, it can be much more severe in our vulnerable populations. There are several formulations out right now. There are 2 monoclonal antibodies that are given through an intramuscular injection for our pediatric population. And then there are 2 vaccines that are highlighted in orange there, Abrizo and Arexvy, that are vaccinations for our adult population. And so for infants less than or equal to 8 months, it's recommended to get 1 dose of nirsevimab, which is the monoclonal antibody. The trade name for that is Beyfortus. And then if you're an adult that's 60 years and older, or in pregnancy, so in pregnant patients, 1 dose of either Abrysvio or Arexvy is recommended. And actually, Abrysvio is the only formulation that is FDA approved and indicated for pregnancy. Next slide, Suna. So our other commonly recommended adult vaccinations, we have shingles, Shingrix. This is a big one that I feel that sometimes gets forgotten, along with the tetanus booster. Sometimes it's hard to remember when you got your last tetanus booster since it's every 10 years. But shingles can be extremely, it can range from being, not too big of an issue for someone that gets shingles to being very, very painful, involving the eyes, post-herpetic neuralgia, lifelong chronic pain. So it is a virus that we can either prevent or, diminish the effects of by getting a vaccine. So definitely a good one to remember. And the age range for this is anyone 50 years and older, or if you're 18 or older and you are, expecting to be transplanted. So that's kind of a key too that a lot of people are unaware of, is that if you are, being worked up for transplant or plan to become immunocompromised through some way, usually solid organ transplant, you can go ahead and get that shingle shot preemptively, since after transplant you are immunocompromised. But this is a 2-dose series separated by 2 to 6 months. And this one I find it gets a lot of misconceptions around it regarding the chicken pox and how it relates to shingles. Is it the same thing? So the CDC will recommend vaccination regardless if you've had chickenpox or not. And that's because the virus will lie dormant after chickenpox and can be reactivated years later and cause shingles. It's really hard to tell by just history. It's hard to confirm, right, if you've had chickenpox in the past or not. Currently, the CDC is not recommending that serotype or a blood test be done to confirm whether you've had chickenpox in the past or not, but just that as a blanket statement, all adults 50 and older, it's recommended to go ahead and get the Shingrix vaccine just in case. And so chickenpox and shingles are caused by the same virus. So they're both caused by the varicella zoster virus. And more than 99% of adults 50 years and older worldwide have actually been exposed to varicella zoster virus. So it's just with those odds, you might as well go ahead and protect yourself against possible infection and go ahead and get that shingles shot. If you've had shingles in the past, Shingrix can help prevent future occurrences. About 5 to 10 years ago, we had a different vaccine for shingles out on the market called Zostavax. It was a live vaccine. It's important to know shingles, the Shingrix vaccine is not live. It's inactive. It's a conjugate vaccine. And Zostavax wasn't very effective. It was removed from market, so it's not available anymore. And the CDC recommends, even if you were vaccinated in the past with Zostavax, to go ahead and update yourself with the Shingrix vaccine, because it has shown to be much more effective than our Zostavax was. Next slide. Okay, so here we have hepatitis B. This is a series that is usually completed between ages 19 and 59. If you're in the healthcare arena, you've definitely either gotten titers to make sure you have antibodies towards hepatitis B and you've been vaccinated. So you complete a 2, 3, or 4 dose series depending on what formulation you receive. There's a lot of different formulations out there. And then also in patients that are 60 years and older with known risk factors, such as chronic liver disease. It's important to get that hepatitis B vaccine. And then lastly, we have here is the human papillomavirus or HPV vaccine. This vaccine is now considered, a childhood vaccine. As young as 9 years old starts this series. But it's important to know that it's been extended age-wise to 27 to 45-year-olds based on shared clinical decision-making with your provider. So if you're at risk for HPV and you are, above the age of 26, now the age has been extended all the way up to 45 to go ahead and get that vaccine, and that it's, shown to be effective. And it's a 2 or 3 dose series depending on, what your age was at initial vaccination. Next slide. And I wanted to mention some resources here. So I don't have a references page because all this information was pulled from the CDC's actual website. It's a great website for healthcare providers and for the public, the community, patients, etc. There's a plethora of information about vaccinations, very easy to navigate and use. So I highly recommend using that website for your information, because it's important to know where our information information is coming from too. So, that Google, that WebMD search is, not always the best information, the best source of information. So I would really recommend that CDC website. And then secondly, your primary care provider is a great go-to for vaccination, health maintenance, making sure that you're staying up to date with everything you need to make sure you're keeping yourself healthy. So if you don't have a primary care provider already, I would strongly urge you to get one of those. And then I didn't add this on this slide, which is so sad, but your local community pharmacists, they are incredible resources for you that are highly available throughout the community at, your local Walgreens, CVS, Safeway, Giant. They're here to talk to you about vaccines as well. So if you have any questions for them, they have been specially trained to give vaccines. And so they've also know a lot about them as well. Next slide. So I'll take any questions you have. I thought this topic was relevant, for the time we're in right now. It's cold and flu season. It is holiday season, family season. You'll be around a lot of family, hopefully. So it's good to think about, making sure you're up to date with vaccinations and protecting not only yourself, but your family members as well.
Chrissy, that was an amazing presentation. I learned a lot in that presentation because just hearing everything broken down, really, really great. As the questions are rolling in from the audience, again, if you have a question, please put it in the comments and we'll make sure to have it addressed here. I just want to start, Chrissy, because you are coming from a transplant perspective, and a lot of the participants or viewers who are looking at this show specifically come for either kidney or related to transplantation. With vaccinations, do you feel there is a need, or some patients come and are not fully aware of the vaccinations that are needed in order to complete a transplant or to at least start the transplant process? Yeah, what's your opinion on that?
Yeah, definitely. The vaccinations part is one of my favorite kind of, sections of the pre-transplant evaluation to talk to patients about, besides the immunosuppression, of course. Yes. Yeah, I find that a lot of patients coming in, they know about the flu shot. Of course, we all know about COVID, but then there are these other sneaky ones that we may not know that we qualify for, like shingles, as we're preparing our bodies and, preparing for transplant. That's a really important one. And then just, there are so many vaccines out there. It's hard to remember, okay, what age do I have to be to get pneumonia, and this one and that one, and all of the caveats with the special populations, right? So if you're immunocompromised, what does that even mean? What does that look like? It could be that you have chronic kidney disease, and that qualifies you for getting the pneumonia shot a little bit earlier than age 65. So there's just a lot of nuance sometimes that regarding and revolving around these vaccines, that talking to a healthcare provider or a pharmacist or can be really helpful.
Great. Thank you so much. I'm going to offer our panelists here to ask any questions or to give any feedback. We'll start with you, Dr. Callender.
Yeah, enjoyed your talk very much. It's a topic that is very dear to me. One of the things that is problematic, though, is that many of my older patients are not aware, and sometimes their physicians don't recommend that they get that extra potency double dose for the flu vaccine. And very often there's the presumption that they will get it, but often they don't. And also, do you recommend this for your transplant patients as well as the elderly, that they get the high potency shot of the flu vaccine?
Yeah, so that's a great question. I don't currently recommend that they get the high dose formulation. It is, of course, definitely okay for them to get the high dose formulation. But the research that I've seen, or at least the studies I've seen out there, they don't show a huge difference between the regular and the high dose, like after transplant. I think because of the immune system being lowered and our diminished sort of response to vaccines at that point, the difference was sort of negligible in some of the studies I've seen. But definitely, for any of our pre-transplant patients, that are older, the high dose vaccine, if you're age appropriate, is definitely recommended.
All right, Dr. Melancon, yes, please.
Yeah, Chrissy, you know, it was a phenomenal presentation, and you know, of course, we know you well because you work on our team, and I want the BlackDoctors.org family to know how important you are to our team and what a great job you do on a daily basis. So welcome to the platform. The first thing I want to say a statement before I ask you a question. The statement is, you know, we just had the young lady, Miss Carrico, who invented the mRNA vaccine, or at least the technology to safely use mRNA in the production of a vaccine, and that's how we got the COVID vaccines that we're utilizing to great effect. So I think that's phenomenal, and we should give her flowers, so to speak, here, because you know we this is BlackDoctors.org, so you know we represent a lot of minorities, and she's a woman, she's Hungarian, she's an immigrant, and for her to have gone through what she went through at the University of Pennsylvania, where she did not go through the process of becoming a tenured professor, had to leave the University of Pennsylvania and start her own company, and then you know wind up winning the Nobel Prize, I think is phenomenal. So the 800-pound gorilla in the room, though, Chrissy, is what sort of conversation do you have with patients about vaccinations? Because all of a sudden, vaccinations have become controversial. They were never controversial. It was just really good medicine that saves untold millions of lives. But you know, since this pandemic and then the mRNA vaccine, I'm wondering what sort of conversations do you have about number one, safety, and number two, safety in particular about the COVID vaccine, the mRNA vaccinations in counter distinction to the more garden variety sort of vaccines.
Yeah, that's a fully loaded question. Definitely the conversation I have with our patients, of course, is specific to their needs and what exactly is concerning them about, let's say, the COVID vaccine. When it comes to safety, efficacy of the COVID vaccine, you know, explaining that this mRNA technology is not new. It's been around. It just has not been kind of harnessed to its fullest potential until the pandemic hit, and we were searching, you know, for the quickest way to roll out a good way to prevent this deadly virus. So explaining to patients that it still underwent all of the very stringent, you know, FDA regulations and all of the regulations that are put into place to keep us safe with vaccinations. It was just on a more accelerated path, and that the mRNA technology allows for that acceleration. It doesn't take quite as long to develop as some of the more traditional vaccination formulations do. Hopefully, you know, I find sometimes puts patients more at ease, you know, just to kind of learn more. And of course, you know, the more that you know, the more that you educate yourself and have these conversations, the more comfortable they start to feel about the vaccine. So I think just, you know, opening up and asking, I always ask our patients, you know, if I say, hey, have you gotten your COVID vaccine? And they quickly tell me no, I ask, oh, okay, you know, why is that? You know, what do you have concerns, or just trying to kind of get more information from them to see, you know, what
See?
All right.
They're out there. She started talking about the COVID vaccine. All of a sudden, she's gone.
I think that's what happened. That was the loaded question. So, Dr. Melancon, Chrissy has kind of given her perspective, but you know, when you see patients, what is the feedback with the COVID vaccine? I still think to this day we're still having conversations, not even from a clinical standpoint, but just socially, about the acceptance of the vaccine, and from Chrissy's presentation about the booster. So what is the perception of patients, and what is your recommendation as far as the COVID and the booster go?
Well, I think that what we're dealing with in the world today, particularly in America, is that, it's kind of like this what we're doing here, right? There's so much more media available to people. It's at everyone's fingertips. You have your phone, you have your computers, the internet, and with all that information, people feel smarter. They feel like they're getting more data. They really feel like there's justification for their emotions and B, opinions. Although there's not. Actually, there's less reason for them to be so confident about what they think they know, because what they know is just what some talking head or what they read on the internet, and it's not vetted information. When you start talking about real data, there's very little question of what is the right thing to be doing. And obviously, vaccines are good. Doesn't mean that they're not possible complications and that they're not groups of patients that need to be careful. I have patients that have had really bad complications from vaccines, and we treat them differently. But yeah, I see people that are very, very emotional about not wanting a vaccine, and they're just adamant, and they feel so strongly about what they think they know, and it can be frustrating. It's not as big of a deal now as it used to be when we were in the midst of so many patients, particularly transplant patients, dying because of COVID. We don't see that anymore, thank goodness. So we've lessened our constraints, so to speak, on how people can get transplanted. And you don't have to get the vaccine, but everyone should be getting the vaccine because it definitely is the safest way to prevent really bad infections. I think on the good side, Suna, is that a lot of the precautions that people started taking as a result of the pandemic has continued, and we see a lower rate of flu and even RSV as a result of people wearing masks a lot more often and social distancing, being more cautious. But that's how I deal with it. I try to give them actual data rather than what they might see on social media.
And I want to make just a quick point before we go back to you, Chrissy, that for our listeners, if you have the opportunity and you are seeing your primary care doctor or a specialist, that is the front row seat to get some information from your physician about what you think the COVID vaccine is, what harm it might be, because if you're strongly opposing the vaccine and you have an appointment, that is the best opportunity to ask a physician outside of, like Chrissy mentioned earlier, going online, WebMD. These are Chrissy, Dr. Callender, Melancon have gone through countless amounts of education and training to be viable and in this position to give medical education. So the same with your providers in your local town. So this is not opinion based. This is all scientific and based on research. So Chrissy, I want to give you an opportunity to finish up the response you had in for COVID vaccination in the patients that you see.
Oh yeah, thanks, Suna. That was pretty much it. Wrapping it up, just having those open, honest conversations with patients. Asking them, what concerns do you have, so that you can start working through those, discussing them, pointing them to other resources, information, Dr. Melancon, other people they can talk to if they have other questions. And, a lot of times I find that it's just that, journey of like fact finding and, going through, asking multiple professionals, what the data shows and what the evidence shows, because like Dr. Melancon said, like the evidence and the data, that is our strongest response that we can give. Right. So.
All right. I want to throw a curveball of a question to you, Dr. Callender, since you are the founder of MOTEP and this weekend is actually Donor Sabbath, which if you don't know about Donor Sabbath, please research it. It's a nationwide initiative to educate everyone about being a donor and transplantation. So Dr. Callender, have you ever seen or have incorporated vaccination in the conversation to donation? If somebody is donating and are not, whether it's a live or deceased donor, if they haven't received certain vaccinations, is that a hindrance to being a donor?
It's an interesting question that you raised, because I think there's a lot of data that indicates that if the donor has COVID or had COVID, been exposed to COVID, that there's no increased risk to the transplantation population. And so this was kind of alarming and surprising to me, but it's clear now that the impact on transplantation and the success of transplantation is not negatively affected by presence or absence of COVID in the donor. So that's a remarkable accomplishment, surprise to me. The issue that has come up with my transplant patients is the issue that a lot of the data indicates that patients who are on dialysis or patients who actually have been transplanted are immunocompromised, and they're not as easy to immunize against COVID and against other things as other patients. And so for that reason, the question is, how many doses does a dialysis patient or a transplant patient need in order to be optimally vaccinated against COVID?
Yeah, to pick up on Dr. Callender's point, he's absolutely correct as usual. And what we have found is that you can trace the antibody levels on these patients. We for a while we thought we were going to be doing it as a routine, but it turned out not to be as necessary. However, we do know that patients on the transplant list or people that are on dialysis that have kidney disease, they do not mount the same sort of immune responses. So one of the things you can order, and I've done this on patients, is to actually order the antibody titer levels to see how high their antibody level is. And just as Dr. Callender said, sometimes they're low, and you will actually give them a booster, another dose, to get their antibody levels up so that they are immune. And he's also correct, and it's one of the things I think about, because I remember in the heyday of the virus when things were just really crazy and transplant programs were shutting down. I was talking to my friends in New York, and it was bizarro world. People were dying. They couldn't keep up with the corpses. We turned down a lot of COVID positive patients who were otherwise young and healthy, and because we just didn't know if it was safe to use those organs. But Dr. Callender's right. Now we do know, and we've done numerous organ transplants in patients that were COVID positive at their death, and you don't pass on COVID. The other thing that we do see even now is that patients that have chronic kidney disease, so they may be hovering around with some level of kidney dysfunction, say they are stage 2, 3, 4, whatever, and get a COVID infection, that can push them right into renal failure. And we see patients like that all the time. We're doing their history, and they will tell you, yeah, I knew I had some kidney dysfunction, but everything was fine. I got a really bad COVID infection, and then I went into kidney failure. So the risk, I think the main message to get out there for people in our audience is that these viral infections can be deadly or very, very dangerous. And the vaccines are incredibly, incredibly safe. And, like I said, there's so many people that are just irresponsibly passing on bogus information on the internet. And the real answer is that the vaccines are incredibly, incredibly safe. Doesn't mean that there are not complications, and there's some people that should not receive the vaccines, but that's a very small percentage of the population. And that people, because I've heard of even problems with the vaccine or any of the vaccines leading to medical issues. It is true. However, for the vast majority of us, the vaccines are safe, and you should stay vaccinated. You should stay up to date with your boosters. And it's not benign to think, oh, I can just, I've had the infection. My friends have had the infection. It's no big deal. If I get it, I get it. Let me tell you, many of the people that die of these viruses have had the infection before, or are relatively young. That's another myth. It's like only old diabetics are dying. Not true. Young, healthy people can die from these diseases, and therefore everyone should be vaccinated. I was Chrissy, as you know, I like to go to the gym early in the morning, and the other morning I was headed to the gym, and this crazy squirrel was like around the sidewalk, and it made me think about tetanus. So if you are bitten by an animal and think maybe the animal was a rabbit, what should you do as far as tetanus and rabies?
Yeah, so most, like urgent cares, ER departments, they would recommend getting a tetanus and then the rabies vaccine as well. So.
And that should be urgent. I mean, you should, like, if I would have gotten bitten that morning, I should have just go straight into the urgent care and receive the rabies and the tetanus vaccines. Or
yeah, that'd be best practice.
Yes. Dr. Melancon, I love that you bring that up. You're right here, because I was going to talk about access. You have given us a list of vaccinations, Chrissy. You've talked about RSV and shingles, the Tdap COVID. And for our viewers, are all of these vaccinations available at a primary care physician? Do they need to set a special appointment with a specialist or a special doctor? Should they go into the emergency department? What is the best way to, one, get the vaccinations that they need, and two, keep record of it in case they need it for another appointment?
Yeah, I would highly recommend keeping records of all your vaccines, because unfortunately, we don't have a super universal database that's going to have your entire history in it. So I definitely recommend keeping those personal records. But as far as best places to get your vaccinations, a lot of these are offered in our primary care doctor's offices. So I'd say, your yearly annual primary care appointment is a great place to get, that updated tetanus booster, your pneumonia vaccine, but then also our local pharmacies. So for our, COVID vaccinations, any vaccination that you want to get sooner rather than later, and maybe falling, out of that primary care appointment window. Let's say you just had your primary care appointment and now, the new booster for COVID is out and you want to get it. Definitely our, pharmacies, even grocery stores like Safeway, Giant, Wegmans, they all have pharmacists that can vaccinate. So that is a great resource for the community that you can, walk in or even make an appointment and get those vaccinations. And you can get a lot of those vaccinations from your local pharmacy too. You can get the HPV vaccine, you can get pneumonia, you can get many of those vaccines from your local pharmacy.
So pharmacy as in Target pharmacy, CVS, the Giant, which we see everywhere. If they have a pharmacy connected to it, you can get a vaccine?
Yes. Mm-hmm.
Groundbreaking. All right. So we do have a few questions from the audience. We'll start with Mary Jordan, who says, should you get the flu and COVID shot together? Chrissy, do you want to start with the answer?
Yeah, sure. You can absolutely get both of them together, especially if you tend to feel relatively well after getting vaccines and you have no issues. Definitely can get them together, no problem. And actually, it's at times recommended to get them together. That way, you're going one time, you're getting both vaccines. You don't have to keep going back to the pharmacy or to the clinic to get vaccines. So if you can, tolerate and getting both of those, then you can go right ahead and do that.
Awesome. Dr. Callender, what is your feedback or on COVID and flu shots being taken together?
Oh, well, this I've seen a lot of data that is controversial, although I think most would say that you might take them at the same time, but not in one shot. You might have a dose of the flu and a dose of COVID separately. There's some data that suggests that together they're not taken as one shot. It's not recommended, but as she said, you can take them both at the same time, just not in one dose. But the other thing that comes to mind is that we're in the height of the flu season, the infection season. And, the question is, what do you tell your patients, Chrissy and Dr. Melancon, about masks and about, one of the misconceptions is that when you get in an airplane, you have excellent ventilation, and that's accurate. But here's what the problem is. You go to the airport and there's no mask.
None.
So I think it is important for your older patients and your transplant patients, your immunocompromised patients, understand that yes, there's great ventilation in the airplane, but in the airport there's nothing. And so the question is, what do you guys tell your patients when they have to go on public places that, for example, go to basketball games or go on airplanes? Do you advise them to wear masks in those situations, or what is your recommendation?
Yeah, I'll answer Dr. Callender. We definitely want them wearing masks, and even among our team members, I can tell you almost everyone who's recently had an infection, including COVID, has traveled. Travel is really, really the way that these viruses kind of continue to pass in our population. So on the plane, in the airport, I'm going to New York this weekend to see my son. We're going to be on a train. We're all wearing masks, and cruise ships. Oh my goodness. All right. I mean, I'm not anti-cruise industry, but I will tell you, best way to get an infection is to go on a cruise. So you need to stay away from crowds. If you think about it, I remember even thinking negatively about the early advice about COVID, when people were saying, you got to be worried about these surfaces and touching things and you have to stay away. But I was wrong, because yes, viruses die very quickly on surfaces and stuff. But when you're moving a lot of people through a crowded area, then you're going to touch something right after someone else. You're going to be in close vicinity. You're going to be smelling the same stuff that they're smelling. So viruses pass very, very quickly. And, I'm trying to put this in a more politically correct way, because people do not necessarily smart things, like being sick, but yet still going out on trips and being in the airport and in the plane seat next to you. The person is sick, yet they decided that's still a good day to travel for some reason. So you have to understand that people aren't necessarily going to do the smart thing and go, I'm not feeling well, so maybe I should cancel my trip, or I shouldn't be in public. No, people don't think like that, or a lot of people don't. So you need to be smart.
Great point, Dr. Melancon. It's this theory of it hasn't happened to me, so it can't happen to me. It can happen to you. Even if you did not catch COVID during the years of 2020 to 2020, you can catch COVID tomorrow. And it's just this misconception that if you haven't had it, you can, or maybe you're super immune. No, it can happen to anyone. And in order to create those defenses, and the reason why this program is so important is to make sure that you're up to date on your vaccinations. It's the most important and the best way to fight anything that were to occur to you in the future. So you've heard it from two surgeons, a pharmacist. We've had countless physicians on this show, be vaccinated and make sure that you understand your health. I do want to point a comment. It's not really a question, and we can kind of end on this from a Dawn Wallen. And Dawn, we didn't ignore your question, but it's a good point we want to make. She says that she explicitly did not get or does not prefer to get the COVID vaccine because she caught COVID in the hospital earlier this year after already having the vaccine. So she clearly feels like it is not, clearly the immunosuppression is not effective, and why she prefers not to get it or the booster. What is your feedback there? And we can kind of, end the program on that.
Yeah, so that's definitely a common thought process. I got the vaccine, but I still got COVID, or I got the flu vaccine, and I still got the flu. And that is definitely a valid, thing to think about. But the reality is the vaccines are not promising that you're not going to get these viruses. It is what the vaccines do and how they work is your body, you can still get the virus, but your immune system is now equipped to fight off this disease, fight off this virus, and in turn can help minimize how severe it is. So especially in the early days of the COVID vaccine, our studies were showing us that it's not necessarily preventing the COVID virus. It's preventing severe COVID and hospitalizations and death, the things that we really, of course, care about, right, with this virus. So definitely, will protect you from more severe outcomes of these viruses.
Yeah, and the other thing is, as your immune system works to kill the virus and get rid of it, then anything that you could do that's going to augment your immune response is going to be better. And by better, it's not just the fact that you are much, much less likely to die because you got the infection after you're vaccinated. So people that were vaccinated and then got the infection you still got the infection, but you were much less likely to die. And you're shedding the virus for a much shorter period of time. So once again, it's part of what we should be doing as a community. And we saw some of the ugly side of this during COVID is that we should be thinking about our neighbors as well, right? So the less you shed, the less it spreads. So the idea of the vaccine is not only on an individual basis, but it's also on a population basis, right? You can get, as you have there, those letters MPH, right? A master's in public health. People that study the socioeconomics and the public health part of disease, what we are trying to do is make sure that we don't have more pandemics, more epidemics. You want to nip things in the bud. So it makes sense that you're thinking, I want to keep myself healthy, but I also want to keep my neighbor healthy. And as we, as a group, are vaccinated, it makes much less likely disease progress. One of the things that's happened, and it's ballooned, it was always in the country and in the world, was this idea of these anti-vaxxers, right? And the anti-vax movement. And a lot of the power of that movement came from a scientific paper that has been totally discredited. It was false data, but it linked autism with a vaccine, right? It was totally wrong, but people still totally believe it, right? Including one of the members of a scion of the Kennedy family. So, but what that has done is it's made these people think that we should be fighting against vaccines. And so what you get are these little blips, measles, mumps, all these things that, basically when I was a kid were virtually eradicated. Now people are getting things like polio. I mean, we've had vaccines for this stuff for, decades. And now because of this wrong thinking, we're going backwards, right? So, I'm not even going to get on my pulpit and start preaching about this, but the point is, this is some of the most effective medicines that we've ever had. You know, one of the things I think sometimes is maybe we had the wrong strategy. We should have said, you can't get the vaccine. We're only going to give it to certain people. You need to wait in this line for hours. Wow. Imagine. Everybody would have wanted it then.
It would be in lines, Dr. Melancon. It would be in line.
Right. They were actually in line for when it was denied early on.
Yeah.
But one of the things I would like to advise the older population, I'm the only one in this group that's over 65, and I'm actually 86. But the people who are in the group of over 65 who get the flu shots, very often the primary care physician do not advise them to get the extra potency shots. Now, that's something that data has demonstrated, that when you're over 65, your immune system is compromised. And as such, you need to have more than the usual dose. What is problematic to me is that I recognize that many primary care physicians are not keeping this in mind. And so to those of you who are over 65 and you go to get your flu shot, remember that there is a special shot, a high potency shot, that is available for those of us who have decreased immune systems because we're older than other people.
Older and better. Older and just better, Dr. Callender. All right. Well, as we bring this webinar to a close, I would just like to say thank you so much to our panelists, Dr. Clive Callender, the great Dr. Keith Melancon, and Chrissy Burrows from the GW Transplant Institute. This was a wealth of information, and we hope that all of our viewers have truly found value in this. Chrissy gave a website that you should replace WebMD with, and that was the CDC website. She put that in her presentation. Let's all just close WebMD together. You know, and there's nothing replaces actually going out and seeing a physician. If you haven't seen your physician in 5 years, this is the year to do it. Set your appointment now, go and see a primary care physician and start that relationship with your provider so you take that autonomy over your health. Thank you so much for joining us today for another edition of Kidney Talks. We are in partnership with the Ron and Joy Paul Kidney Center, MOTEP, the Minority Tissue and Transplant Education Program, the Pennsylvania Avenue Baptist Church, and none other than BlackDoctor.org. Because our next program will be scheduled on the week of Thanksgiving, we'll be coming to you again December 8th of 2023. Thank you so much and have an amazing weekend.
Thanks, Suna.
Thanks.